Department of Oral Medicine and Radiology, Government Dental College and Hospital, Nagpur presents to you the method of intraoral radiography, paralleling angle technique. Paralleling angle technique is also known as right angle technique or long cone technique or the Fitzgerald technique. It fulfills most of the principles of shadow casting and it is hence more superior than bisecting angle technique. This technique is different from others as it involves the use of various film holders. Paralleling angle technique, various types of film holders are used to place the film intraorally. The type of film holders are RIN XCP, precision film holders, and snap array film holders. RIN XCP film holders are most commonly used. XCP stands for extension cone paralleling. These are of various color codes. Anteriorly, white color is used and posteriorly red and blue. The parts of RIN XCP ring holder are aiming ring, positioning arm, bite wing bite block, and image receptor holder.
Now let's see about the patient position and preparation. Posture of the patient should be straight and erect. Ask them to remove glasses and removable appliances if any. Avoid their tight closure of lips around the bite block. Head position of the patient should be such that the arch is parallel to the floor of the ground.
So now we will see the placement of film in patient's oral cavity. These are the rins or film holders where we have the slot for placement of film. This is an IOPA film. This is the front side and this is the back side. The front side has an occlusal dot. So for maxillary anterior teeth, we will place the occlusal dot towards the occlusion. The film is to be placed such that it is parallel to the tooth to be radiographed. An angulation of 20 degree is permissible when we place the film parallel to the tooth to be radiographed and ask the patient to bite on the bite block. So this is the position for maxillary anterior teeth. For mandibular anterior teeth, the occlusal dot will be placed towards the occlusion and the film in the lingual vestibule. Again, the patient will be asked to bite on the bite block. So this is the position for mandibular anterior teeth. Now we will see the position and placement of film for maxillary left posterior region. The occlusal dot towards the occlusion in the slot for the film. We will place the bite block as near to the tooth to be radiographed and ask the patient to bite on the bite block. Just make sure that the arm while taking radiograph for posterior teeth is parallel to the tooth to be radiographed. The rin for maxillary left posterior can also be used for mandibular right posterior region. So this is the position for mandibular posterior region. This is the position for mandibular left posterior region and this will be the position for maxillary right posterior region. While placing the film in anterior region, we place the film vertically, whereas while placing it posteriorly, we keep the film horizontally. Also, while placing the tube head is placed or the position indicating device is placed as close as possible to this ring.
Position of film positioner and PID for various quadrants are as follow: maxillary right posterior teeth, maxillary left posterior teeth, maxillary anterior teeth. And now for mandibular right posterior teeth, mandibular left posterior teeth, and mandibular anterior teeth.
Here are the following advantages. First is accuracy. This is how accurate the image is. Then simplicity, duplication, and decreased secondary radiation. Excellent bone level assessment can be seen. Elongation and foreshortening is not there. Interproximal caries are clearly indicated. Disadvantages include difficulty in film placement and patient discomfort. Gagging reflex can be appreciated in the image. Increase in exposure time and difficulty in positioning in the third molar region. Holders need to be autoclave.